This is Residents in a Room, an official podcast of the American Society of Anesthesiologists, where we go behind the scenes to explore the world from the point of view of anesthesiology residents.
Our goal, number one, is to provide excellent, safe anesthetic care.
Allow yourself to be uncomfortable because you're going to grow and you're going to learn and you're going to expand.
You got to be good, you got to be willing to work, and you got to be a Swiss Army knife capable in any room that you walk into.
Correct.
In private practice setting, it's just very important to understand how to do that. Welcome to Residents in a Room, the podcast for residents by residents. I'm your host for this special episode, Alexis Rice, HCA Sunrise Health CA3 Chief Resident. I'm joined today by my program director, Dr. Ryan Hafen, who's also a partner and clinical governance board member of USAP Nevada, along with Dr. Kelly LeBlanc, partner and clinical governance board member of USAP Texas Gulf Coast. This episode is sponsored by US Anesthesia Partners, and we're recording this at USAP's Future Leaders in Anesthesia Conference in Austin, Texas. Doctors Hafen and LeBlanc are going to take us behind the curtain and share their expertise on life inside private practice. Fortunately, I'm not alone. I'm joined by a fellow resident. Can you introduce yourself?
My name is Dr. Alexa Macias. I am a CA3 at Houston Methodist Hospital and very excited to be here today.
And now let's meet our guests. Doctors Hafen and LeBlanc, can you give us a little intro to you? Tell our listeners a little about your pathway and your current role.
Well, thank you, Alexis. Appreciate it. I'm Dr. Ryan Hafen from Las Vegas, Nevada, born and raised. I'm the current program director of our anesthesia residency in Las Vegas, the only residency in Nevada. I did my training at UNR Med School, then UCSD in anesthesia, and I did my fellowship at Stanford. Been back in Vegas about 9 years. And initially came out, worked at a trauma center. Then I did ICU for 3 years. And that's when I first started working with residents at Mountain View Hospital in Las Vegas that has the anesthesia residency program. I was working at the time per diem with USAP Nevada platform. And by platforms, that's just our practice in Nevada. We have different platforms all over the country and in different cities and states. I then decided about 3-4 years ago to join full-time with USAP Nevada, and at that time there was a vacancy in the residency program director. I applied, and I was very blessed to get the opportunity to train our residents, and I've been the residency director ever since.
Hey, thanks for having me. I'm Kelly LeBlanc. I'm a physician partner in Houston. Undergrad at Howard University, medical school, UTMB in Galveston, Texas. I did my residency at Baylor College of Medicine, where I was chief resident. Got a chance to rotate at Houston Methodist Hospital during my residency, loved it, joined the group, which at that time was GHA, and have been with them ever since. We're now USAP. It's been a great experience. I sit on our clinical governance board. I sit on our clinical operations committee, which is our national committee that helps govern our clinical care throughout the country. I'm currently the site chief at Houston Methodist Cypress Hospital. I'm formerly the site chief at Houston Methodist Baytown Hospital, where I was chief of staff as well. So lots of opportunities, and it's been a great ride.
Can you talk about what it's like to work in private practice, especially just out of training?
We're not going to let you go your first day by yourself. The last thing I'm going to do is have you come, this is your first day, and boom, you're there. Right? Mm-hmm. So let's partner you with someone. Let's make sure you have your access, your Epic access, your badge access. Let's make sure you know everyone. You know all the players. Let's introduce you to the OR staff, the teams, maybe some of the surgeons, to give you that opportunity to get a little more acclimated. And then after that, it's how do we then get you in the operating rooms? We're going to start you on the easier cases. Bread and butter, this is what you're used to. And so it's being intentional in that, making sure you have the support. We do have a peer support team where we partner you with someone. So if you have a question or need, you have a phone a friend. How do I do this? I still do that. I still call my partner physicians and say, hey, what would you do? That's important, right? And so setting up our new physicians as they come in and transition to start a career with us is really important. And also getting feedback and checking in with you after a few months to say, hey, how it's going, get your feedback, and then give you feedback as well on what we see and how we also think we can partner with you to kind of further your experience and improve it.
When somebody starts with us, we actually assign them a physician mentor. And that person checks in with them regularly. If they go on to a partner track with us, we actually do regular check-ins with HR. And so we try to engage that person early and give them a support system early, because when you first come out in private practice, it is a whole new ballgame, new people, new places, fast pace, and you're by yourself. And it can very quickly feel like you're on an island. And so we try to make sure that isn't what people feel. We always want them to have 2 or 3 numbers in their phone that they can quickly call and say, hey, I haven't ever ran into this situation. Can I just bounce this off you? Or, hey, I'm having a problem with this surgeon. How do you deal with that person? Or, hey, I got something going on at home. Can I talk to you about that? So we formally approach it, and then hopefully that's enough to start, and then take an active role and look for those mentors. You're going to find people that you have commonality with, share interests with, engage those people, take them out to dinner, get to know them. Our chair of our group always tells the young residents, the new partners, be an owner. Mm-hmm. And that doesn't mean buy stock and become an owner. It means have an owner mentality of your group. Get involved. If you don't like something, well, then change it. We are the traditional physician-led private practice group on a local level, and getting those partners to be engaged really helps them start a career path towards leadership and allows them to meet more people, which then allows them to explore more mentorship. And I think career satisfaction goes through the roof once you start engaging those individuals to start being a part of the solution and not just the problem.
Yeah.
So very formal type of stuff, but also informal. You know, we're a little unique because we do have a residency program. We actually have residency families where we assign one faculty member, a person from every PGY level, and that's the little family, and they take them out to dinner, and they take them bowling or to the movies. And so you have this little tiny close-knit mentorship family. And then as they go through residency, we try to mentor them through it. And Alexis is joining our group, and we're super proud of that.
Wonderful. Congratulations.
So she's, for 4 years, we've been bringing her along and raising her up like one of our own children. And and she's going to be awesome. And so we try to engage them even at that level to bring them into the group and show them what their future could look like. And, she's chief resident, so mentoring her in that leadership role. These are all things, and they started very early in your career.
I really enjoyed having a mentorship family.
That's a great idea.
Yeah,
I like
really
that.
Awesome. Especially because there's one in each class.
Yeah.
So not only do we have that attending mentor, but we have each other every step of the way too, which is awesome.
You all are exposed to such great mentors. And let me just say this. You don't have to have just one mentor, right? This is my mentor for work-life balance, right? They were able to maintain their family and balance, and that's great. And maybe that's the person I go to when I feel like I'm being challenged with my work life and trying to hold on to that. And then this is the person I aspire to be. If I want to be ASA president, Pat Guillaume is right there. I can go talk to Pat because he's a physician partner, and I can talk to him and say anything and everything, right? So it doesn't have to be one person. Yeah.
It sounds like mentorship is also an active process. It can't be passive and just you're going to get all those mentors. You have to actually seek.
Absolutely.
That's one thing that I learned about. Like you gotta ask that mentorship. But everyone's always super willing to lend a helping hand, but sometimes they don't know you need a helping hand. And
correct.
It's up to you to find the person that, like you said, maybe they see a bit of you in them.
Absolutely.
That person is going to be a great mentor for you down the road. So I do feel like, being at this USAP program, there's a lot of fantastic mentors. Had a lot of opportunities in their career and just a lot of experiences that I've been hearing about since I was a fresh CA1. And it goes to the way that our attendings teach us. Of course, we get taught the clinical pearls and all of the academics, but as one of my attendings always says, anesthesia is the easiest part.
It is.
When you get out, that is the easiest part, and the hard part is everything else that you're going to do.
Absolutely.
So we're in that unique position where we are learning that kind of, healthcare is a business.
Healthcare is a business.
Medicine is science, healthcare is a business, healing is an art. But every day my attendings are telling me, you need to start thinking about this. And now that I'm a CA3 and I will be, I also sign, so I'll be joining USAP. I get a lot of that. You're going to be with us next year. You're going to be an attendant. You need to start thinking like this. You need to start thinking like this.
Yeah, that's correct.
Start thinking. And it's all things that have nothing to do with academics. It's other things, higher level things to be successful as an attending in a private practice setting.
Correct.
It's a big academic hospital, and there's, of course, a lot of teaching going on, but at its core, it's run like a private practice.
Correct. Well, yeah, you were both part of our residency programs, and so you have the unique opportunity to get the best of both worlds. You're able to see the academic, but you're also able to see what private practice really is. And you're able to see it in a very good way because you're seeing a very strong physician-led, physician-owned organization, and you're watching physicians do more than just delivering anesthetics and support care team, but you're also watching us run the organization, make the clinical decisions, making the business decisions. You don't get a chance to see that often, but you get to see what really goes into running a successful anesthesia company. So I wish I had your opportunities. I really do.
I trained at a large academic center at UCSD. Awesome place, great people, wonderful training. But the difference transitioning from that to private practice was just the pace. The speed of private practice surgeons was, for the first probably 3 to 4 months, was quite shocking. I came out and I remember my first day, I looked at my schedule the night before and I had 4 robot hernias scheduled plus 3 lap choles, and the timings looked like they were out of some imaginary book, and it said I was going to be done by 5 p.m. And I hit the ground and learned to turn the room fast, learned to wake my patients up fast, be efficient, be safe, use all the principles I learned in residency, but do the work of a private practice anesthesiologist. And at the end of the day, our goal, number one, is to provide excellent, safe anesthetic care, but also there is the efficiency component in private practice.
Well, you had a basically perfect segue to the next question. What would a typical daily routine look like, and how much autonomy might we have over our practice and routine?
Typically, the night before I get my lineup, I get up early, just like you would in residency, and some days I'm working with residents. Sometimes I'm by myself. Sometimes I'm with the care team of the CRNA or CAA. But the day-to-day doesn't change clinically that much. Take good care of my patients. Usually, if I'm not on call, it's a 7 to 5 or 7 to 7 shift. The interesting part of it that I never knew about is not only am I going to be taking care of these patients, but at 4 p.m., I'm going to jump on a call with Human Resource Committee or Finance Committee or our governing board. And now I'm doing the business of medicine during the day and being involved in that part of it. So there's more than just the clinical aspect in private practice. If you join leadership, you will be involved in all the day-to-day types of things with scheduling and HR and finance and all the things that you need to run a very successful practice. And then, just the rest of the day is go home and be a good dad, change caps from a doctor and leader, and be a dad and a husband and do all the things that you're supposed to do. And learning how to flip that switch is important too. And that's pretty much my day-to-day. I love our group in terms of call. We don't get crushed for the call. We take 4 to 6 calls a month. I work probably 50 to 60 hours. I make great money. I have autonomy, and I think I have a great work-life balance. We can take as much vacation as we want. I could work 80, 100 hours if I want, and then I could take less vacation and make more money. And so we have a lot of flexibility in our practice. And so your life can look as varied as you want it.
So can you talk about the kinds of clinical cases we might expect to see in private practice? I know some people, new grads, get worried whether they're going to be pigeonholed into certain types of cases or if they see a broad range of work?
Wherever you go and you're just coming out of residency, what I would really want to make sure everyone knows is do not go somewhere where you're only going to do one type of anesthetic. Unless you did a fellowship and that's all you want to do, and I just want to do peds, or I just want to do hearts, make sure you get exposure in everything. You do not want to pigeonhole yourself that early in your career. Give yourself as much variety as you can. And one of the things that I thought was very helpful for me is when I started my career is I not only had to go to Methodist, but we had to cover all the Methodist hospitals. And just by having that exposure of cases, not only case variety, but surgeon variety, administration variety, operating room variety, I learned so much. So it could be a little daunting at first. It's like, oh my gosh, I'm going to a new hospital. I'm comfortable here. Allow yourself to be uncomfortable because you're going to grow and you're going to learn and you're going to expand. So you don't want to do it all right away, but you want to make sure you have the opportunity to do that.
Yeah, I totally agree and would echo that. I think this is a hard question to answer because the type of cases you're going to see is dependent on the opportunity that you seek out and that you accept as a job. I know when I first came out, I went to the second largest hospital in the state of Nevada and the only level 1 trauma center, and I did everything. And that set the basis for my career. I think I'll add a layer to that. It's not just you need to be looking at case types and variety and maybe even sites, going to different sites. Going to an ambulatory, the first time I went to an ambulatory standalone surgery center was like 4 years into my career. And that's a whole nother adventure. You want to talk about feeling like on an island, that can be very isolating. The other thing I'll layer onto that is what is the ratio of doing cases on your own versus doing them with residents versus doing them with a care team. There are jobs out there where you can immediately come out and you'll see it on GasWorks. It says 100% supervision job. And that is true. And I would caution that in a graduating resident, you really do want to be the one doing your own cases. So find that job that maybe has a 50-50 mix or a 25-75, but be cautious of just going into that gig where it's like, all right, cool, this is a huge paycheck and it's all outpatient GI and I'm just supervising a care team. You will be pigeonholing yourself in your career that you just aren't comfortable doing everything. So I would say seek out the jobs in which you can further your education. And I always say, look, there's some retirement jobs out there. They're best for when you're closer to retirement. If your goal is to become the best anesthesiologist that you can, which it should be.
The more you're out of the operating room, the less comfortable you're going to be. You want to make sure you continue to do some of your own cases. It may not be 100%. I think being able to learn how to function in a care team setting, you've got to know how to do that because we're never going to go back to the days where it's, physician, you do your own cases all the time. We'll never do that. So being able to master those skills is also very important. So the variation is necessary. Mm-hmm.
And for us listeners who are scrolling through GasWorks and trying to look for jobs, what should we be thinking about when we go on interviews? How do we identify opportunities to grow? How do we gauge how well organization will meet personal needs? Any tips on how to tease out opportunities for growth through interviews?
I'm going to just go right back to the statement I made earlier with one of my mentors who has taught me to be an owner. And so the first thing I want to know when I'm sitting in an interview with a group is, are there opportunities to get involved? If there are not, I would be very worried. Okay, so if it is just a job where you have zero input on anything, hiring, firing, scheduling, vacation, contracting, anything, and there's plenty of jobs out there. Probably 60% of the jobs right now are looking more and more like that, where you just show up, you get a paycheck, and that's it. For me personally, I worked in that situation for 4 years. For me personally, if I were to go out on an interview, I know what I want. in a job that's given me fulfillment, which is being involved to be able to shape my career, the career of my partners and colleagues, and grow anesthesia in a physician-led way. That is very important to me when I'm in an interview. What opportunities are there for me to be involved and grow? Do you have committees? Who does the contracting? Is a physician involved in that? Who does scheduling? Is a physician involved in that? I think that's super important for me. That might not be important for other people. So you have to think about what are your principles? What do you want in a job? But for me, that's a big, big, big one. Seek out somebody in that interview process that has similar beliefs and life goals and maybe family goals, and talk to them about, does this job allow them to function the way that I would want to function? Maybe I need more time off for my kids. Maybe I need more time off for my wellness. Maybe I like to do other things outside of work that take some time. I'm a triathlete or something. So don't be afraid to find those people when you're interviewing and ask them very personal questions.
I'm just going to be honest. One of the things that residents always want to know is, how much am I going to make? I was like that. I had 3 kids. I want to know how much money am I going to make? But that's not the most important thing. And so I say that to make sure that we address it, because we know that that's important. You want to make sure that whatever is being offered is competitive. You want to be very weary if they're the highest paying person, because then you're like, why? Why are they paying the most? And I would try to kind of read more into it and investigate. But that being said, pay is important, but it's not the only thing. So one of the other things that, to me, elite culture, that's the most important thing to me, because I am going to be at that site, at that workplace every day during the week, and working with these same people all the time. If I get into a bind, I'm going to need these people to back me up. As a mom, if I need to have some more flexibility in my schedule than what is already there, I need to switch a call or to go to a sporting event, which I did often, raising my kids. Is there someone who's going to be able to partner with me and help me? Those kinds of things are important. Not only that, but when you're talking about, do they value whether I'm a mom or dad? It's a job, so they're going to need you to do the job. But what you want to know is there flexibility in the packages that are offered? If I want to do a nocturnist job, if I want to work 7 to 3 and no weekends or no call or 1 call a month, what does that flexibility and range look like? Because that may be where I need to start. Or is there an opportunity for partnership? I'm gung-ho, I'm ready. I want to get out there and start working because, hey, it's time to make some money and pay these loans back. Can I do that? And then when I realized I can't keep working like that because I want to stay married and be involved in my kids, is there opportunity to flex down a little bit? What does that look like? And then if I decide I want to be a leader after I've done all of these things and I feel like I still have that bandwidth, are those opportunities there? What does that look like? And how grand is that? Is it just running the schedule? Or can I be a leader? And what does that mean? Can I be a site chief? Can I be a leader of a platform, or can I do the business of it? I mean, there's so much involved in running an anesthesia practice that you don't learn about in residency. And so you want to ask, are those opportunities there as well? And for me, what was important is, what's the opportunities? If I want to look at diversity too, and that's important to me. I want to make sure that my voice will be accepted and can add value as well. Will I be able to have a seat at the table? And so I kind of want to look and see, what does that look like too? If there's no one at all in the company that looks like me, then I'm going to be a little apprehensive, because I'm going to say, will they value me? And I would ask those questions. So I think those are things, and sometimes we don't think about that when we're coming out of residency as being important, but those are definitely things that I would ask, as well as all of the business aspects regarding how sustainable the practice is that you're looking to join. So looking at revenue and how do they manage their revenue, and look at their partnerships with the hospital systems that they're involved in. Are they leading in those hospital systems, right? Or are they just providing the anesthesia? Because if all they're doing is worried about providing the anesthesia, then they're not really partnering with those hospitals. And let me tell you, that's important. Those hospitals need you to be able to run an efficient OR, because an efficient OR means that their revenue is going to go up, which is important for them, right? They want to make sure that the patients are going to get great quality, which we'll all do, but it's more than that too, right? Are you going to partner with all the areas in which you're able to take care of patients? And there's so many different things. So you want to make sure that that partnership with hospital systems is there. So all those things are important for you to ask. But you said something important, Ryan, and that is to make sure you ask people who work there what their experience is like and find out who's the newest hire. Talk to them because their experience is going to be most meaningful for you. And ask, what was your experience like when you first started? What was the onboarding like? How did they treat you? Did you get the support that you need? Is there someone that you can call if you need help? Ask all of that. That's important. And then finally sit and observe and feel what it's like to be there. You can learn a lot just by observing.
Great points. Flexibility is huge, and I agree with all those things. I think something that is very unique to both of you that I'm kind of curious about, and I know Alexis has a different experience than maybe other residents, is that you're trained in a private practice group. So what, to your guys' view, and that's going to be much different than maybe someone in academic training, what's your view on what private practice is going to look like once you're graduated, and how might that differ than maybe some of your colleagues that are at academic centers?
So I think the first thing, you got to be good, you got to be willing to work, and you got to be a Swiss Army knife capable in any room that you walk into.
Correct.
And I do feel that when I see my attendings walk in the room, it doesn't matter whether it's a crani, spine, chole, GI, they get in there, they're confident, they're pushing the pace, and they're efficient, and probably because they've taken so many opportunities over their careers, and they have seen so many different sides.
Correct.
You know, at my hospital, they're credentialed at multiple different sites within the med center. So one day they're here, another day they're over doing OB in a totally different institution, and everywhere you go, they do cases differently. You know, the anesthesia is different from place to
Exactly.
place. The surgeons are different. Like, you can do a 2-hour knee here, and then, you know, you can do a 8-hour chole. You know, you never know what you're going to get. So,
You get comfortable at being uncomfortable.
yeah,
Right.
exactly. So I feel that to be in private practice, you have to be good. You have to be willing to take opportunities, and you got to develop those skills being comfortable in uncomfortable environments. And that comes from constantly putting yourself in those shoes.
Exposure.
And exposure, exactly.
Make sure, again, and this is, I think, why it's so important that when you're looking for a job, you're making sure that when you start, you have the support, because that is the expectation in private practice. So you want to make sure that you have the support of the, of the team that's already there to help transition you until you get used to that. I think that's really important.
You'll all be fine.
So in our residency program as a CA3, we have the opportunity to do a rotation called practice management, which allows us to help run the OR board and which providers will take care of which cases, take care of the add-ons. This case got canceled. Where can we utilize this provider to make the day more efficient? And I think in private practice setting, it's just very important to understand how to do that. And I love that we get to do that as a CA3.
That's a great opportunity.
Yes. And I'm excited to do that. I haven't been able to do it myself, but looking forward to it. And I think that's just a very important rotation to help guide us to understand how private practice works and why versus academic centers.
I agree.
Well, thank you so much. This was a very informative conversation and a lot of fun.
Very informative. It's so nice to hear everybody's experiences and just kind of take a look inside everyone's brain for it.
Thanks for having us, and we wish you all the best of luck. We're so excited for you, and for all of you listening, good luck with your endeavors. Good luck with your careers, and I hope this helped you in any kind of way when you're looking for a job.
Echo it. Thank you guys for spending your time, and to everyone listening, no matter what career path you choose, we need all of you. We need the good academic people. We need the researchers. We need the private practice docs. You all matter, and wish you the best in your future careers.
Well, thanks so much for joining us for this episode of Residents in a Room, the podcast for residents by residents, and today sponsored by U.S. Anesthesia Partners. Come back again soon for more Residents in a Room.
Bye, guys.
Bye-bye. Take care, everybody.
U.S. Anesthesia Partners has grown from an innovative idea into one of the nation's premier single specialty physician-led groups. Trusted by hospitals and healthcare systems, we deliver high-quality anesthesia care focused on always improving the experience for both patients and anesthesiologists. At USAP, residents can join local practices with a supportive culture, strong physician-led leadership, and a commitment to investing in the future of our specialty. To find a practice that fits your lifestyle and career goals, please visit usap.com.
Join us for Residents in a Room, where we'll share timely info, advice, and resources designed to help residents succeed in residency and beyond. Find us wherever you get your podcasts or visit asahq.org/podcasts for more.